What's up, beautiful people? Another day, another study. We previously talked about air pollution, particularly particulate matter or PM 2.5, and the risk of cardiovascular disease associated with it. We know from the literature that individuals that live within 200 meters of highways or people who live in high traffic areas where there's 100,000 or more vehicle trips per day have an increased exposure to PM 2.5 from like tailpipes, tires, and brake wear. And approximately 24% of Americans live near these high volume roadways. And as discussed, PM 2.5 has been associated with cardiovascular disease and dementia. It is one of the toxins, environmental toxins, that I am concerned about, as I think we have substantial literature associated with harms. We know that small reductions in blood pressure can have clinically significant impacts. So a 2 millimeter per mercury reduction in systolic blood pressure reduces the risk of death from ischemic heart disease by 7% and stroke by 10%. So small reduction, large benefit. This trial was a crossover trial where they had HEPA filter and a sham HEPA filter for 1 month, and then they switched. And it was designed to see if there were reductions in PM 2.5 and particulate number concentration and effects on blood pressure. Well, in those who had systolic blood pressure less than 120, there was a slight but not statistically significant reduction in blood pressure. However, participants with a blood pressure above 120 millimeters of mercury had a net difference of about 3, favoring the HEPA filtration. An exploratory analysis revealed that participants who spent more time inside their homes received more benefits. These results are in line with other human clinical trials showing that HEPA filtration and reducing PM 2.5 concentrations are associated with around a 2 to 3 difference in systolic blood pressure. So in my opinion, this aligns with the growing body of research showing how air pollution, this particulate matter 2.5 or PM 2.5, is deleterious to both cardiovascular and brain health. And this is something that we should be looking at a policy level, how to reduce our exposure to these air pollutants.